Hi there, my name is Dr. Guy Carnazza, and I practice in the town of East Rockaway, New York. And today I have a treat for you. I'd like to share with you a case that we recently completed for a patient who was suffering with a lower fixed bridge on his bottom front teeth. He had an old bridge which was causing him quite a bit of trouble. And what we had done was remove the old bridge and replaced it with a new bridge. And I'd like to share with you how we did that. This patient, when he initially came to us with this old bridge, it's about 20 years old, he claimed. He was having a lot of trouble keeping the area clean. He had a lot of difficulty with speech, food getting caught underneath, and his gums were bleeding excessively. So upon further examination, when we took a closer look, we saw that the bridge, where the missing teeth of the bridge, he only had his two canine teeth. All his bottom front teeth were gone. He had actually suffered trauma in this area and lost those teeth due to trauma. So when we further examined the areas, we noticed that the tissue was very inflamed because the bridge didn't adapt or fit very well. It wasn't fitted to the gum line of either the what we call anchor or abutment teeth, or to the space where the teeth, or the ridge where the teeth were missing. And as a result caused him to trap quite a bit of food and debris, which ended up making it difficult for him to keep clean, and this debris became hard and calcified, what we call tartar or calculus, which is mineralized plaque. And this gave him quite a great odor in his mouth when he spoke, when he swallowed, when he chewed. When he brushed his teeth, he'd get a lot of bleeding and lots of inflammation because he wasn't able to keep this area as clean as he had liked. The real thing that prompted him to come to us was when he was speaking, he said food just was flying out of his mouth and he wasn't able to keep anything behind those teeth. So what we did was we actually removed this bridge and found quite a bit of decay underneath, and the gums were all very irritated. So we had the areas completely cleaned up prior to us making his new permanent bridge. And we allowed the gum tissue to subside and heal a little bit from all this irritation and inflammation and get him working on his home care. And in the end, we were able to construct a brand new bridge with the same type of design. This is a porcelain to gold substructure bridge. And as you can see in the photos here, the increased health of the gum tissue. These gums were so severely inflamed and diseased that they were running the risk of him losing those remaining anchor teeth. So we've increased the ability for him to cleanse and keep the area clean, but also maintain the health of the tissue with nicely adapting margins of the final bridge, whereas the previous margins were not near the gum line, actually a plaque trap, and difficult for him to keep clean. And in the end, the patient and I were very happy with the final result because we achieved both an aesthetic, a functional, and a hygienic, most importantly, a hygienic result, which improved this patient's health. We went from severe inflammation, which was prompting to eventually lead to bone loss or gum and bone disease, to health. You could see the difference in the before and after, where the tissue is so angry and inflamed, and in the after shot, nice, pink, healthy gum tissue. So, that's Discover What's Possible. I hope you enjoyed this today. If you'd like to learn more about cases that we do in our practice, you can go to carnazzadental.com and see more before and afters like this. We are located in the town of East Rockaway, which is only 20 minutes from JFK International Airport. If you'd like to come in and have a free consult, we'd be happy to sit with you and talk about your dental needs. I want to say thank you, and we'll talk to you soon.